as I mentioned, thank you again, Jacqueline and Thai Health, for giving us this opportunity. We are really excited to share our work with you today. So we know video games captivate, and can they go one step further and improve health? Litesprite builds games to help people manage chronic health conditions. Clinicians and players rely on our data insights. Oh, wait a minute. Sorry, I'm having issues. There we go. All right. So we have won over 20 global health innovation awards, including recognition from these organizations. We are considered one of the leaders in digital therapeutics and digital health. As many of you know, and we were kind of chatting about this before the presentation started, COVID-19 and the need for mental health support in specific has increased dramatically. The existing care gaps that have been there have widened already. The need for affordable and accessible clinically validated self-help tools has never been greater. Virtual mental health is also a top priority from an employer perspective. And then on the clinical side, which some of you I think are a part of, if I'm not mistaken, Jackie, that's also care has been impacted. Frontline providers, from just the frontline providers themselves experiencing issues, but delivering care is also more difficult because physical distancing, there is now a push to get tools that can deliver in my care at scale, but also allow for remote patient monitoring. So that's kind of the state of the world of today. So our clinically validated mental health video game is called Sinasprite. It's the first to win a US Surgeon General Award and the only one recommended by payers and clinicians today. There is a lot of stigma associated with mental health, and it doesn't have to be that way. Games are fun, they're approachable, they have focused attention, inspire and empower people to learn skills on a long-term basis. They also create strong ties with communities. The data insights from our clinical dashboards have already helped clinicians monitor patients and deliver customized care beyond the clinic walls. One clinic started teaching Medicaid patients about meditation after our reports showed they were trying to learn the skill on their own. We collect a unique player-generated data set that includes voice, image, video, and text. We can construct digital biomarkers and build predictive models that can identify at-risk patients. At its core, Sinasprite is a self-help tool that empowers people on a long-term journey of self-discovery. It's a safe place where they can explore their emotions, understand their triggers, discover what evidence-based techniques learned from them works for them, and then also learn those skills. At its core, Sinasprite is what we call a game-based self-help mental health digital therapeutic. It supports the emotional and clinical journey of the chronically ill. We are a trusted support pillar during their greatest hour of need. And in a clinical setting, we have worked with a range of diagnoses that you can see here. The game itself is based on Bandura's social cognitive theory, which is a commonly accepted framework by clinicians. A player chooses from a range of activities. These mini games are a unique combination of evidence-based treatment methods and mindfulness strategies. This includes meditation, journaling, diaphragmatic breathing, physical activity, and gratitude. Some mini games like the gratitude allow the player to connect with their support network. An important element of Sinasprite is the game's protagonist and the main character, which is Socks the Fox. Socks is a peer to the player and addresses their emotional needs. In the game, Socks becomes a Zen master by teaching people these effective coping skills. Socks guides players through journaling and exploring their emotions, meditation, breathing, and then the world expands as they learn those skills. Doors literally unlock and open as the player continues to work on themselves. Our clinical results are the reasons we are the first video game to win a US Surgeon General Award and the reason we've won over 20 Global Health Innovation Awards. Our clinical improvement of a 2.5 point reduction in the PHQ-8 result translates into a person going into work versus staying in bed 2 more days each week. When Sinasprite is used as an adjunct therapy to, therapy, excuse me, it has the same scale improvement as a pharmacologic. The important part, though, is clinical results don't matter if people don't use it. And Sinasprite appeals to a broad range of people, which means it's really great for families. We have built a technology that solves mental health issues and people use. Our players have already completed over 8,600 sessions. We have tested this on thousands of patients, and our retention rates are 3x above the industry average and 2x above Headspace. Medicaid patients with complex cases have said that Sinasprite is life-changing. They're inspiration every morning, and they are ready for the next level. Here's what a few players have shared with us, specifically in addition to those comments, in a little bit more color of the type of individuals we're able to help. Hilda is a Medicaid patient. She has several behavioral health diagnoses, and she finds it convenient. And it also helps her with her loneliness through journaling with socks. Suzette also finds it convenient. She feels like it's a real game, and she loves the meditation. For Darren, it's a healing tool. Socks is calming and a digital companion on a healing journey. Our trusted self-care tools and unique patient data were redefining care before COVID and have proved more valuable since. And here's what clinicians have said about their ability to customize care. Anne sees that the reports show a game with benefits. For Nicole, the data showed her how the treatment was progressing and her client felt more supported. And Brian observed that his clients achieved lower scores faster and had a better application of the retention of concepts. And for the first time, he can customize strategies. The University of Washington's Primary Care Innovation Lab have determined that a primary care clinic with 2,000 patients could realize an additional $55,000 in revenue annually. And here are some other areas. In addition to primary care, we also have validation in 3 other care settings, and these are the codes that we can be billed under. So we're looking for partners to work together and reach more patients. If you're a leader at any of these organizations, please send me an email. And in the next few days, we're going to be launching our newest and latest release of Sinasprite, which will have all the UX and the UI that you're in the experience that I was able to share with you today. So games get people engaged. Engaged people get better faster. Thank you.
Swatee, that was awesome. Thank you so much. I know people will have lots of questions, and so I'm going to stand by and just invite anybody who has a question to ask it now.
Swatee, that was awesome. Literally like 2 weeks ago, I went to a rural medicine conference up in Fargo, North Dakota, and we were talking about trying to get, you know, isolated individuals that are either farmers or vets, something like this, and it's awesome to see this. As a person, on a personal note, like someone that struggled with mental health issues, I think it's awesome, and I'd love to see this get bigger and more widespread for a lot of people. Great job.
Thanks.
Hey, Eric, great presentation. And I was wondering the slide with the 55,000, tell me again how that was, that they billed Medicaid, or where did that 55,000 come from?
It's an economic analysis that was done by the University of Washington's Primary Care Innovation Lab. And it's using the BHI intervention code. And so the nice thing about that, if you're following the collaborative care model, it doesn't you can have a skilled healthcare worker. It doesn't have to be an MD to do that. So you can have, there's, I think, one first time code is like to set up and set it and like to get them started on the intervention. And then after that, it's a monthly, what do you call it? It's a monthly bill. billing for monitoring, ongoing monitoring. And it took our clinical results of, and it made certain assumptions. And then it's also on and then they also looked at the incident rate within that particular population. And so we looked at 4 or 5 different states, from like Washington State, New York. And so it's a blended average.
Great.
So I'm happy to share the study as well.
Yeah, that'd be great.
Eric, what's your role? Are you part of a clinic?
No, I'm a program officer with a state foundation here in Alaska. We're actually a state corporation, but we operate like a foundation, and we fund all sorts of behavioral health, substance use, support for providers out there. So we're a funder.
I gotcha. Yeah, you're not with Matsu, are you?
Nope, no, I'm with the statewide Alaska Mental Health Trust Authority.
Oh, okay, yeah. So
Well,
yeah.
I was going to say we partner with Matsu Health Foundation all the time on stuff.
Okay, gotcha. Yeah, so we have a particular resonance with a lot of the Medicaid population. So as you saw, so it actually has quite a broad appeal and range.
Yeah, that's awesome. Yeah, time's right for that with the pandemic and moving to real digital applications across the state and distance.
So,
Sorry.
Swatee, can I, you said that you could share a report with Eric. Could you also share the slides? And I can certainly do a post-presentation email introduction.
Mm-hmm. Yeah, I'll send over the, Eric, did you want the full report or the executive summary?
You know, if you send the full report, that'd be great. You know, some of the partners that we deal with in the nonprofit tribal world have a real, they'd like to see that full analysis when I'm talking with them about things like this.
So would this be for the tribes, or would it be across
Everybody?
Everybody.
Because we work with both.
Okay, got it.
And anyone else that would like an email introduction to Swatee, I'm happy to do that. Are there any other questions that people might have?
Yeah, Jacqueline, it's Jake. First of all, do add me to your introduction list. I would love to continue the conversation. But Swatee, my question is actually technical. You know, on an app like this, where you potentially could have a large user base with a lot of, I don't know, sensitive information. What do you do to protect that information? And do you find that is a significant hurdle when creating something like this that is both meant to be a consumer app, but also, people are pretty concerned about these really sensitive issues?
Mm-hmm. Yeah, no, it's a fair question. You know, we started in the clinical area, so we started working. Our first deployment was at an active military base. So as far as the privacy and data requirements and how we're even storing the information, the PHI, we've met all the compliance whenever we've had to go into or any clinic, whether it was the Army or we worked at Passport Health Plan in Kentucky and Centerstone Health, which is a big payer and behavioral health provider down in the Southeast area. In New York City, we're deployed with the Jewish Board and Samaritan Daytop, two of the largest New York City behavioral health providers. So so for us, it was a pretty easy, it's not a hard lift. We're actually moving into consumer because the demand has shot up. We had over 900 signups since March, and it's all organic. We haven't been doing any marketing or SEO. We've been listed on a couple of COVID support resources. And the New York City text line has been, moving people or recommending people. But outside of that, so for us, it's not an issue. We've also had our Bayer Pharmaceuticals, or Bayer as they call it in the US, is also another strategic investor in us. And so they also did a compliance review, and we're in the clear right now. I mean, we will also anticipate, as we work with larger organizations, there'll be the SOX 2 compliance that we'll have to go through, any other additional HIPAA protocols we need to meet, EHR integrations. But we expect that to happen, and we'll address them as needed and necessary.
Sure, and your users don't seem to mind using putting this information in an app. That's not been something that that's cool.
Yeah, I mean, you can see it. These are real
Yeah.
journal entries. I can show you. There was another one I shared with Jacqueline. She said that's too sensitive. Like, she's like, that's too intense. So there was some more really sensitive information that we get. So no, I think, I mean, there's going to be a group of people that are going to be suspicious, and understandably so. That's okay, but we've had thousands of people so far. I haven't really raised the flag, so to speak.
Cool, thank you.
And Jake, what's your role?
I'm on the board at Health Tech.
Oh yeah. Okay, that's right.
Jacqueline, is there time for me to throw a question out?
There's absolute time. Go ahead, Kai.
Swatee, I think you kind of started touching on my question, but maybe a little more. I'm just curious, to what degree do individuals who download this app and who might start using it, are they able to use it as intended? And to what degree is it able to help them maybe understand their situation, to put words to, am I depressed, am I anxious, am I whatever, and maybe help them find a path to a practitioner or clinic that might actually be able to professionally engage with them and help them further in that. To what degree is this an on-ramp for somebody being able to learn about mental health and to find the resources and the clinical assistance that might help them actually more fully understand their situation and the treatment that might be beneficial to them?
Yeah, it's a great on-ramp. In short, that's actually what some of the employers who reached out to us have said, because it is such a universal appeal. It's so approachable. It's straightforward. If you've never had that experience, it's also very destigmatized. It doesn't look like it doesn't. You look at the experience, it just doesn't even really look like. It just looks like it literally look like on your phone that you're playing a game, right? Like, it doesn't even look like you're doing mental health. So if you had to go through here.
And is there a connection so that somebody who gets to some stage in the game, and I'm going to be, this is, I know, a little extreme, but let's just say you get to some stage in the game, at which point the game says, you're depressed, and here are 3 providers in your local area that you might call to get a more formal assessment by a trained clinician to do that. Can it actually be bolted on to local or regional services that somebody can access?
Absolutely. It is a great adjunct. Part of the clinical results is that this, in conjunction with therapy, gives you the same point reduction as a pharmacologic.
But does it provide you the referral connection to actually know, here's the name of a
if we have a directory that we can refer, right, we can certainly make those connections. What we've seen is that when we've worked with individual therapists per se, it's a really heavy lift to be a technology provider and then also create the connection points to the providers. And a lot of providers right now, at least the individual therapists that we're finding, at least down here, they are mainly focused on getting EHR and billing, right? And then this as an adjunct is not something, like, it's even a revenue generating opportunity for them, and doesn't seem to be a sizable one for them. So, but it's certainly possible, like, if it's part of, it's not hard to do. We could, and it in the sense that if we have a directory and a list of the providers that are in the area, we can certainly make those connection points. And it's a great on-ramp Like if someone's like, yeah, I want to learn more about myself, or I want to continue the dialogue, absolutely, right? Because it opens the door to a much more meaningful, and when you have someone that's open to this idea, then they're more than likely therapy will work for them. Right?
Exactly. Yeah, good. Thank you for that.
Yeah. So, I mean, what's your role, Kai?
I'm just a pot stirrer right now. I'm a sabbatical from the university. I get involved in economic development and entrepreneurship and have a great interest in health tie and health tech areas. So I'm just trying to learn about it. I've spent, plenty of my time literally and figuratively on the couch. So I have a personal interest in the field of mental health and how to deal with it, but also recognizing that this is such an important problem in Alaska and trying to help people understand both, where they're at as well as what their next steps could be, to me is just an important thing to be building the capacity in our communities to be able to do this. And this sounds like one of the tools that could be approachable for people to find that path into the assistance that might be beneficial for them.
Yeah, it absolutely could. And if we had the directory of providers that would use this in adjunct, right? Because ideally what you want is a provider who just doesn't want to use it as a referral, but will use this as a tool to continue to allow that patient on their journey.
So
But what about, okay, I'm sorry, could I say one thing?
go ahead.
Sorry. If you looked into Google startups or that sort of venue, you could initially, for free promote certain local therapists or healthcare providers as an additional page on the website if they wanted to go to that option. So that you could kind of link them up really locally if possible.
Okay. No, I don't know anything about that. So
yeah, I'll talk later. I'll send you an email.
Okay.
Again, Steve, I'm so excited that you're here and that, Steve is actually part of a startup that will present in January, and he's just yesterday went through the Launch Alaska accelerator kind of first initial steps. And so again, this is the purpose of Health Tie, is to bring different connections together and to cross-pollinate what we can do and grow. I mean, so I want to thank you all, and I especially want to thank Swatee. This has been wonderful to have you here. A really awesome presentation, and clearly, I think almost everybody has asked for a follow-up email introduction to you, Swatee, and this is just a first step. I mean, we have a long time that we can work together, and thank you very much.
Yeah, thank you guys. And thanks for your time today, everybody, and the thoughtful questions.
Thank you. Great job. Thanks, Jackie.
Bye.
Thank you.
Bye.
Okay. Goodbye now.